have you been? It's been 6 months. Good, good. Everything's going good. Alright, so. Patient presents with a class 1 occlusion. Get a little suction in there. Overbite is 30%. Overjet is 3 millimeters. Huh? I have an overbite? Oh. Patient has a convex profile. 20 is slightly rotated labially. The anteriors have prominent mamelon. What are they saying? Alright, everything looks good. See you in 6 months. Hi guys, this is my dental vocab vid number 3. I'm going to be using my boy Tyrone to help me out. The topic is orthodontics, alright? So we're going to jump right into it. A class 1 occlusion or a class 1 bite looks like this. This is the ideal, where the top slightly overlap the bottom one. I think it's so funny because when we tell people to bite, they think that ideal is when the top teeth come just to meet this way. Okay, so ideal is class 1. Example of class 2. What causes this? Genetics can cause this. Thumb sucking beyond age 4 can cause this. Pacifier beyond age 4 can cause this. Yeah. Okay. Class 3 looks like this, where the top jaw, when the top jaw is behind the lower jaw. So the prominent jaw is the bottom jaw. If you have someone turn sideways and their chin is extended a lot farther out, a lot of the times it's because of their bite. Okay? And so it looks like that. Ooh, Tyrone. Okay? Another common thing is called a crossbite. And a crossbite is when your upper row of teeth, kind of sits on the inside of the lower teeth. Okay? This is normal, ease, like that. Okay? Normal, or ideal, I should probably say, and crossbite. Hope you can see this. Alright. Another common thing is an open bite. Okay. In this edge-to-edge bite, do you see this opening? This opening where you can see through? That's how I mean a posterior, in the back, open bite. Okay? So if your child has meat, there's no way, if the teeth aren't touching, there's no way for them to really chew it up to the smaller size that they need to in order to swallow it. Another one is spacing. People want to correct spaces, they'll go and get braces. And opposite to that, crowding. Crowding is another reason why people get, another reason why people have braces to correct it. Some people have perfectly straight teeth, but their jaws are not aligned together. So your central teeth, your middle teeth should be lined up straight down the middle. Should be a straight line going down. Okay, there are some people whose midline are off just slightly, but have that corrected. If the midline, it means the middle row doesn't line up. Okay. Another common reason is protrusion. Protrusion is when the front 4 incisors or front 2 incisors are tilted that way. Okay. Another common reason why people will get braces is due to tongue thrusting. Tongue thrusting is when you are unable to swallow without your tongue forcefully pushing up against the back of your front teeth. So try it now. Like take your tongue, put it in the roof of your mouth, and see if you can keep it there and swallow. Okay, if you're unable to do that, I'm not saying you do have tongue thrust, but there's a likelihood that you may have. So those are like the most common reasons why people get braces. Yeah. Also too, I'm sure you've noticed that children are getting braces younger and younger than what they used to. And what orthodontists are actually doing is they're treating them in 2 different phases. Okay, I guess like this basically it's a case-by-case basis, but it's a 2-phase process. Phase 1 is when they want to correct the jaw. Is it aligned? Is the midlines off? Is it, you know, too far forward? Is it too far back? So phase 1 would correct that. And with that orthodontic correction, baby teeth are usually present because they're 8, 9, 10, you know, at that age, there's still baby teeth in there. So they only put braces on adult teeth, or they only put brackets on adult teeth. You can't put them on baby teeth, on primary teeth, because they're not, you know, the roots are shorter and, you know, they could fall out, you know, just it's not very stable. So that will be considered phase 1 when you correct the relationship of the top row and the bottom row. Phase 2 is when they're actually correcting the position of the teeth. Now, I can only give you the basics. I don't know in full detail, but yeah. Baby teeth. Now, I know you want your baby's teeth to look perfectly aligned and no space in between, but just so you know, baby teeth, when they're like picket fence, those are perfect, because you have to think about it. The permanent tooth is 50% bigger than that baby tooth. So when that baby tooth falls out, you have a huge permanent tooth that needs to come in that spot. So if your baby teeth are very, very tight, there's a possibility that there could be some crowding. If you have spaces and for baby teeth, it's going to allow more room. Not saying that they won't need braces, but it just kind of reduces the likelihood of it when they are picket fence like that. What else? After having braces, it is important to continue to wear your retainer for life. Okay? For life. If you really want to get your money's worth out of those braces, you need to wear that retainer for life. A lot of the orthodontists will tell you just to wear it at night after a certain point of wearing it, opposed to wearing it throughout the entire day. Some orthodontists will have a metal, top bottom, that will have a metal bar on the inside here that is connected, usually the canine tooth to the canine tooth. You can't see it unless their mouth is open, but it's a metal bar, and that helps maintain the front tooth. Those of you who have orthodontic braces and are struggling to floss with them, go to my oral regimen video and find out how to brush around them, how to floss around them. The best electric toothbrush is the Sonicare toothbrush. I have my quirks about the Sonicare. It's a personal preference. When I buy expensive things, I like to get the most bang for my buck, and it turns out that with the Sonicare toothbrush, you have to have a mouth full of water in order to get the full capacity or the full efficacy of the scrubbing ultrasonic thing that it's supposed to do. Okay, so it works awesome, especially in comparison to a manual toothbrush when it's harder to clean around. You cannot use an Oral-B that circles, that spins around. Okay, that spins around in a circle, because you're going to tear up your bristles. They're not going to last a month on the metal wires. Okay, because you have the braces, and the orthodontic brushes are going to spin around in a circle. It's going to start to shard it as it continues to spin. So if you're going to use electric toothbrush, it's going to have to be the ultrasonic Sonicare toothbrush. Okay, just because it doesn't spin around in circles. So I think that's it. I hope you guys learned some more. It's getting harder and harder. I feel like I've taught you everything that I know. Any questions? Send me some comments. Do not ask me how much braces cost. It all varies. I cannot give you a bracket even. That's not my area. So, yeah. They may not. Oh no, Tyrone. They may not be able to help that. It might be their bite. Like we were talking about open bite. Open bite is when the teeth, when you technical diff. Tyrone. Wait a minute, you cutting up. Give me 1 minute.